you tell us more about health literacy in the school curriculum?
Yes, thank you for the opportunity to take part in this webinar. So various national and international public health measures to decrease the spread of the COVID-19 have highlighted the importance of teaching school-age children different health literacy competencies, such as how to wash hands properly and how to act if one recognizes the symptoms that might relate to the infection. Similarly, the importance of teaching the skills to handle the infodemic and to take social responsibility have been highlighted. When quick reactions and changes in people's daily habits were called for, health literacy of the population, including the school-age children, became and still is high in the political agenda. However, the quickly spreading virus clearly showed us the importance of addressing health literacy as a proactive measure. Several competencies take time to develop, as does the creation of the infrastructure and other conditions for such development. Reacting is good, but may be insufficient within certain time limits, whereas proactive measures build more prepared means to meet the complexities, uncertainties, and sudden challenges or problems. Health literacy could be seen as everyone's right. It is an important determinant of health and linked with health disparities among adolescents. Furthermore, it is an asset that fosters development of autonomy, empowerment, and participation in promoting common good. International comparative studies have shown that there are differences in health literacy levels between and within countries. These two figures show some findings from a 10-country comparison using the data from the Health Behavior in School-Age Children study. The analysis showed that every fourth has difficulties in assessing the credibility of the health information and in comparing the information gained from different sources, and the differences between the countries are clear. When, for instance, around 30% of the adolescents in Germany report difficulties in assessing if the health information is right or wrong, the corresponding figure in Finland is around 14. So abilities to think critically and to find reliable information secures genuine access to and power over the knowledge and knowing. So we could propose that one explanation for the situation in Finland could be the fact that we have an independent and obligatory school subject called health education, where together with subjects and other subjects and cross-curricular themes, these types of competencies are learned. However, more research is certainly needed to confirm this argument. So between the countries and regions, there are differences in the ways school curricula have been developed and structured. However, at the general level, we could argue that school curriculum echoes what is valued in the society, such as what competencies will be developed during the school years and for what purposes. Furthermore, the curriculum may give a firm guidance for organizing teaching in an age-appropriate manner and a national curriculum for developing the local curriculum. So according to UNESCO, the curriculum is the central means for enacting the principles of inclusion and equity within an education system. As health literacy is linked with the health disparities, the learning of health literacy competencies at schools, and here by taking into account the individual needs, surely follows these principles. However, if health literacy curriculum is offered only in some countries, states, or schools, it may help in minimizing the health literacy differences only within those contexts. To reduce health literacy differences at the global level would require more ambitious aims and to introduce such a curriculum in all schools. So here we shouldn't forget that first, schooling in general should be secured for all children, as currently there are striking inequalities in education provision. So currently only some countries, regions have explicitly introduced health literacy in their curriculum. However, a closer examination could show that several other countries do have some elements of learning of health issues in their curriculum, but they don't necessarily call it as health literacy. Anyways, there are different ways in which health literacy can be addressed in a school curriculum. Some countries have an independent and obligatory school subject, which is built around the core competencies identified for the health literacy. Some countries, on the other hand, teach health literacy as a transversal competence or as a cross-cutting thematic area that should run through the different subjects. Sometimes health issues are combined with other subjects such as physical education, or thought as part of so-called career subjects, like home economics, when a special emphasis will be placed on teaching some health issues during the career subject lessons. Surely there are pros and cons for various options. If, for instance, health literacy forms as a cross-cutting thematic area, it has a potential to be focused on several times in a week throughout the school years and to bring along health aspect into various subjects and perhaps even into daily practices at schools, to mention some. However, this would require that health literacy should be handled in all subject teacher or other teacher training programs. Teacher training is key to support that teachers become genuinely aware of and committed in teaching such transversal competence and gain qualification to teach and integrate it into their main teaching subjects and with an age-appropriate manner. On the other hand, if health literacy forms as an independent and obligatory school subject, it has a potential to reach the same status as the other subjects. Often schools are organized around the subjects, and if health literacy or related subject would have the same status as other subjects in the curriculum, it is more likely that it will be offered enough commitment, time, and resources to conduct such teaching in a purposeful manner. Furthermore, it is more likely that related teacher training programs could be developed. Similarly, however, it may be that the teaching and handling of health issues is left in the hands of those subject teachers only, and the schools will not necessarily adopt health literacy and health as part of their broader missions and practices. Certainly, the curriculum where health literacy and health are in different roles, such as both subject-bound and cross-curricular, could be introduced as well. One clear benefit for curriculum approach is that as compared to short-term and extracurriculum interventions, school curriculum ensures longer-term emphasis on the issues that are included in it. After all, often the curricula are developed for several years forward. And so with this slide, I want shortly to give an example on how health education and health literacy can be seen at the system level. And the case is from Finland. So in Finland, the subject to be taught in schools are law-based, as is the amount of university-level studies required to be qualified as a subject teacher and the amount of hours to be allocated to various subjects in different grades. When health literacy was named as an obligatory subject to be taught in schools, it meant also that related teacher training had to be established. These acts frame the national curriculum development, which serves as a guiding document for local curriculum development. Health literacy is used as a theoretical and a guiding framework for identifying and defining the goals for the health education instruction and the assessment criteria for the competencies that pupils should master in certain grades. In Finland, there are various publishers who produce textbooks and teacher materials to support teaching and learning in school subjects, including health education. All of these together influence on the way teaching and learning of health issues and health literacy will take place at schools. However, though a school curriculum is an important and powerful educational document, and schooling has the potential to even out the differences in, for instance, cognitive skills that might be conducive by the different out-of-school contexts and influences, important is what happens at schools. So to sum up my presentation, I would like to share you the talk made by James Coleman in 1968 when he wrote an essay on the concept of equality of educational opportunity. And particularly the sentence where he says that educational equality of output is not so much determined by equality of the research inputs, but the power of these resources in bringing about achievement. Thank you.
Thank you very much, Leena Paakkari.